Welcome to today's episode of the Be Sure podcast. Living with epilepsy involves challenges beyond seizures, including stigma and emotional impact. However, with the right treatment and adjustments, many people with epilepsy can lead active lives. To help us better understand this, we are fortunate to have a renowned consultant neurologist with extensive experience in treating epilepsy. Welcome, Doctor.
Yeah, welcome everyone. I am Dr. Nayanjeet Deka. I am a consultant neurosurgeon, and today we will be talking something about called epilepsy and the basics and the essentials. So, uh, basically, I will try to keep it as simple as possible uh, without using much of the medical terms. So, see, basically, our human brain uses tiny electrical signals to do everything, whatever we do in the body, starting from walking, sleeping, how we feel, how we feel things, how we have fear, how we feel happy. Everything comes with an electrical signal. So when there are abnormal electrical signals in our brain, too much of abnormal electrical signals in our brain, then our body starts, our brain becomes overloaded. And that is where we call it a seizure. So some of the doctors even say the seizure is like this form inside your brain. But most of the time we have seen that whenever the patient will have seizures, the most common symptoms which we have seen is that they used to lose their consciousness. There will be some involuntary jerky movement, which we also call it convulsion. Then some patients say that they will have a sterile look, they will look just blankly to the point, and some become confused. Some even say that they have a severe emotional reaction, like they have sudden fear and panic attacks.
Let's start with the basics. What exactly is a seizure and how does it affect the brain?
Yeah. So, mm, as I said earlier, seizure is an abnormal electrical impulses, sudden abnormal, huge amount of electrical impulses that it goes around in your brain. So it can start from one part of the brain and it can spread to the other part of the brain. So depending upon the site of the seizure, site of the brain which is involved, you can have a array of symptoms in this patient. As I said earlier, it can start with convulsions, loss of consciousness, to emotional changes, sudden panic attacks, or even a movement upon a part of the limb or a part of the body. So most of the times they persist for say 3 to 4 minutes, and then patient again becomes normal. So this is how you find seizures nowadays.
What is epilepsy?
See, epilepsy is a medical condition. So it is when you diagnose a patient to have multiple episodes. Actually, to be specific, it's more than 2 episodes of unprovoked seizures. Now you will ask me again, what is unprovoked seizure? See, unprovoked means without any preceding cause, like those causes which are likely to cause seizures. For example, infection, fever, head injury, trauma, or any kind of brain tumor. So somebody is having those, then you can't say that person is having epilepsy. Otherwise, that was the first definition.
What are the different types of seizures and do they affect people differently?
Yes, definitely. See, uh, as I said, there are different areas in the brain. Like we have the frontal lobe, the parietal lobe, the temporal lobe, and the occipital lobe. Both have their all have their some specific functions, and all the lobes are interrelated. So depending upon the site of the lobe or the site where the fever is occurring, all patients are going to have different symptoms. But still, not to confuse our peers, we can just make it simple. We can say okay, there are only two types. One is the generalized, where the whole body is being affected, and one is the focus.
I see. Now, can you explain what causes epilepsy? Is there always a known cause?
See, what we see in our clinic is that nearly 50% of the adult individuals which come to us with seizure, most of the time we don't find any cause, no specific cause. But other half of the population, yes, we can find a cause. Out of the most common which we have seen is that it is the head injury, where there is confusion to the brain, or there is a hematoma in the brain, or then again there is a stroke, then infection, CNS infection, all sorts of CNS infections. And again, in the older age group, we have seen, along with stroke, Alzheimer's disease can also cause seizures. If you go to the younger age group, those children or the kids who have seizures, most of they are actually genetic factor is mostly involved, and most of the time they are syndromic. So these are some of the causes.
Well, that's really helpful to understand. Well, what are some of the signs or symptoms of epilepsy that caregivers should look out for?
Okay. See, as I said earlier, different areas of brain, different kinds of seizures. But then again, we will again have to stick to the most common symptoms. So first symptoms which you can see is that the first symptoms which we have to see, we find most commonly is the loss of consciousness, which will present as loss of consciousness. Then suddenly the patient will start to have convulsions. So this is the abnormal jerky movement of the body. Sometimes some patients may have only a flickering movement of the face or of the arms or the feet. So sometimes they may just stare vacantly, not paying attention to the surroundings. So sometimes they may even have a scream, like a panic attack, as I said before. So these are the most common symptoms. Other symptoms are also there, but they are rare. Okay.
Now, let's talk about something that many people with epilepsy face: stigma. Can you tell us why epilepsy is often misunderstood?
Um, Actually, yes, unfortunately, yes. See, the problem with epilepsy or seizure is that whenever these things are nowadays going up and out from this, these things are reducing in the urban areas, or actually where the people are educated. But still in the rural areas, in the deep rural areas, people are still not educated about seizures or epilepsy. So what happens is that whenever they see a patient having seizure, the first reaction is fear. They don't know what to do. They think that the patient is dying. So better I will not stay here. I will just run away from here, or I will call somebody else and let him manage. So that is the first
Yeah.
thing which causes the stigma. Now, uh, but I don't think uh, it's not possible along the help of the doctors or anyone. Ultimately, the whole society should be educated about how to manage a patient with seizures, not epilepsy or seizure. How you see when you see a patient having seizures, how do you manage this patient? How you treat? Otherwise, it always becomes a stigma. People always think the patient having seizure so must be maybe he is having cursed in his past life. Sometimes some people think that maybe he or she is being possessed by some spirit or like that. But ultimately, it's the education. See, if the patient or the people, the community is educated, then things can run fine.
How does this stigma affect people with epilepsy?
Yeah. Thank you for the question. Actually, this is one of the most important questions. See, as a doctor, as a citizens of India, we should all see these people are suffering from kids their childhood. Suppose a child is there who is who is living with epilepsy. So what will
Yeah.
happen is that when he is still a child, the other normal people, normal children will not be allowed to play with him. The parents will have, okay, don't go and play with the child. Okay. Now that will be his childhood. He will be barred from all the games and all. Then again, when he becomes an adult, he will have finding difficulty job. What will happen? The employer will think, yeah, okay, if I keep this guy though he or her, then he will be a burden to me. He will have seizure. Again, I have to take a doctor and everything else. Then again, at the time of marriage, what will happen is that people will be reluctant to get married to such kind of a. They will think that maybe this genetics will pass on to my daughters, granddaughters, whatever. So ultimately, they will face this kind of stigma throughout the life. And as I said before, that as a community, we should understand and we should be more supportive to these people.
Absolutely. Now let's move on to managing epilepsy. What are the common triggers for seizures that patients and caregivers should be aware of?
Yeah, those things we find during our OPD sessions is that sir, I had a episode of seizure. So first thing we ask, how was the sleep? So most of the time they say that if I was studying late, somebody will say, sir, we had a marriage party, so my sleep was disturbed for last 2 3 days. Then on the morning when I woke up, I had a seizure. So sleep is
Yeah.
one of missing sleep is one of the most important factor. Then high stress
Mhm.
level, which is found in urban people. Secondly, if you miss your medication, which are supposed to take daily, if you miss those medication due to some other cause or other reason, then it's also a factor. Then having some other ailments, like if you're having a fever or any other major illness, then also the person may have seizure. Then again, flashes of light, loud music, and also we have seen that uh, especially in women, that during their menstruation, due to some hormonal changes, they used to have seizures. So we advise patients to maintain a seizure diary so that they
Mhm.
can make a track record of the seizures and they can find a pattern on how the seizures are occurring and they can find the triggering factors.
That's a great tip, doctor. What other lifestyle adjustments can help someone manage epilepsy?
See, there are several healthy habits you can go. First is that you should take adequate sleep. Adequate sleep is a
Mhm.
must take. Otherwise, you are going to have seizures or you will become prone to seizures. Secondly, I will ask to have a little bit of less stress now. But just by saying less stress will not work. You will have to work for it. So I think meditation will help. And secondly, if you talk to your counselor or your support group, that will also help. Then working out or doing exercises is also good. But then again, heavy exercises or doing high risk sports, this has to be done under the guidance of a doctor only. Other than that,
Mhm.
taking a balanced meal every time will work out just fine.
Thank you so much, doctor. To wrap up, could you share some safety tips to help prevent injuries during seizures?
See, at home, most of the time, if you say if you're working, if you're home alone, then better not to you avoid those things which can fall on your head, like using a cord cable, using a sharp instrument above the table or desk. And suppose if you're using the kitchen, then better to use non-breakable items. Okay, and if you are home alone, then better avoid using the stove. And then if there is the oven, you can use the oven. And if the patient or the person has a frequent history of fall on the ground while having a seizure, then you can use the soft carpeting, which will also help you getting head injuries in the long run.
Thank you so much, doctor. This has been incredibly informative and helpful. We hope today's discussion helps listeners better understand epilepsy and how to support themselves or their loved ones, of course. Any final thoughts?
So I would like to say that you can live a normal life with epilepsy. It's not unusual. Patient is to go to school, get a job, get married, work out, and do everything you want. But you should know what are the triggering factors, when are you going to follow up with doctor, and when on what not to do, like not missing a sleep during and also not taking some abusive substances like alcohol or tobacco, which is most commonly used. Other than that, you will find that, and you should not be worried because there is a large community which is supporting you.
Thank you, doctor. And thank you to our listeners. Until next time, take care and stay informed.